Good morning. I am here to present my paper on a study on stereopsis and contrast sensitivity among children and adolescents with myopic refractive error. As we all know, myopia is a leading cause of correctable low vision, especially in the pediatric and adolescent age group, whereas stereopsis and contrast sensitivity both are important for a good quality of vision in a patient. Stereopsis, owing to its contribution to depth perception and contrast sensitivity for discriminating objects from their background, both are very important in determining the quality of vision in an individual. And hence, the study objectives of my study objectives is to determine the correlation of contrast sensitivity and stereopsis with myopic refractive error among children and adolescents with myopia. The methodology used was a hospital-based cross-sectional analytical study done in a tertiary eye care center in South Kerala, and the study population included myopic patients in the age group 5 to 19 years attending the OPD bar pediatric clinic at the same setting. And the sample size was calculated with respect to the following formula, and the sample size was taken as 150, and sampling method used was consecutive sampling. The data collection tools used were a proforma to enter the relevant data, Snellen's visual acuity chart, Tidmeth's dots and circles stereopsis chart to assess the stereopsis, and Pelly-Robson contrast sensitivity chart to assess the stereopsis. Contrast sensitivity. Coming to the inclusion and exclusion criteria, the inclusion criteria included patients in the age group 5 to 19 years of age with myopia or myopic astigmatism with best corrected visual acuity of 6.6 in both eyes. And we excluded patients with any ocular condition other than myopia as cause of visual impairment, patients with mental retardation or poor cognitive function, and those with history of prior ocular surgery or trauma. The study variables included demographic variables like age and gender, clinical variables, visual acuity, stereopsis, and contrast sensitivity. And the study procedure used was an informed consent was obtained from the parents and assent obtained from the study participants, and demographic details collected. Unaided visual acuity was recorded, a thorough ophthalmologic examination was done, and the amount of refractive error or best corrected visual acuity was assessed from the post-mydriatic test. And monocular contrast sensitivity was assessed with Pelly-Robson chart at 1 meter, and binocular stereopsis assessment with Tidmeth's dots and circles test at 40 centimeters. Coming to the results, with respect to age distribution, most of my study population fell within the 10 to 14 years age group, contributed to 54% of my study sample. And owing to type of myopic refractive error, I had included both myopic astigmatism and myopia in my study, and majority was contributed by myopia, 42%, followed by simple myopic astigmatism, 41%, and followed by common myopic astigmatism. And coming to distribution according to amount of refractive error, most of the patients came to fail within the less than 3 diopter group, that is mild degree of myopia, and then 11.3 within the moderate degree of myopia. And the refractive error among the average refractive error among the sample was about 1.5 diopters plus or minus 1.2. Coming to distribution of contrast sensitivity was found to be abnormal in 68% of my study population. And stereopsis was found to be equivocal about 17.3% and 1.3% had abnormal results. Coming to association of contrast sensitivity and degree of myopic refractive error, as you can see from the study, as the degree of myopia increases, as we go from mild to severe degree of myopia, the amount of patients with abnormal contrast sensitivity is seen to increase, like 67% in mild myopia and 72% in moderate myopia. And as we go on to the severe degree of refractive error, it almost reaches about 100%. And the relationship between contrast sensitivity and myopic refractive error had a negative correlation value of minus 0.244, and it was found to be statistically significant. Now coming to type of refractive error and contrast sensitivity, we had the following results. We can see a strong relation between the presence of myopia and the contrast sensitivity decrease, and it was found to have a strongest association between myopia. 78% patients among myopia had poor contrast sensitivity, which is followed by simple myopic astigmatism and compound myopic astigmatism. Coming to association between stereopsis and myopia, we can see here 86% patients in the mild refractive error had normal stereopsis, while as we go on to the moderate degree of refractive error, 59.1% only had normal stereopsis. This was also statistically significant. Coming to the discussion, similar results were obtained by Chanjalji et al., which is my parent study, which also showed simple myopia more than 3 diopter was associated with reduced stereopsis. And another study by Goa et al. Showed higher cylindrical and spherical refractive errors are associated with lower stereo acuity. And Bistradi et al. In 2007, myopes showed reduced contrast sensitivity in comparison to emmetropes, and it also decreased with increase in degree of refractive error. Coming to the limitations, my sample size was small and the sample did not have adequate representation of patients with severe degree of refractive error. My conclusions, stereopsis and contrast sensitivity both are reduced in those with myopia, and stereopsis is found to decrease with increase in degree of myopia. Also, with respect to contrast sensitivity, pure myopia had the strongest association with contrast sensitivity, which was followed by simple myopic and then compound myopic astigmatism. Myopia is not only important for in the sense of visual acuity, it is also important for providing a good quality of vision in these patients, and hence early detection and correction of myopia is important in these patients. Thank you. These are my references.
Yourself, you have done that stereopsis?
Yes, sir, stereopsis.
Pileropsin?
Pileropsin also, it's available. So,
you have checked the patient?
Yes, we
All
checked
the
for
patients.
each patient.
You have done or somebody has done?
No, we checked it. I checked it, sir. I checked it.
Number of patients you checked?
Stereopsis was checked in, we had 150 patients, and stereopsis was checked as a binocular function in all 150 of them. For contrast sensitivity, we took monocular, so a total of 150 subjects, total 300 eyes were chosen. And so monocularly we took the results.
Okay, you told mild, moderate, severe. On what basis you have made mild, moderate, severe?
With respect to my parent study and references, I have divided. Mild refractive error as less than 3 diopters of myopia, 3 to 6 was taken as moderate, and more than 6 as high myopia or severe degree of refractive error. You
did fundus examinations and all?
Fundus examinations at the end of the study, because after assessing stereopsis and contrast sensitivity, I assessed the fundus. It was also done during their previous cycloplegic refraction period also. It was also cross-checked.
Anyone had fundus finding with the power of 3 and all?
No, sir.
Nothing?
No, sir. I had kept it as my exclusion criteria also. Any other pathology we wouldn't be taking into consideration. And the severe degree of refractive error, the sample was low. That's one of my limitations also. So,
what was the highest myopic power in your study?
At least one, sir. It was minus 0.25 diopter.
That is the least. The highest?
Highest was minus 6.25.
6.25. What do you think the reason for reduced contrast sensitivity in myopes?
Reason...
with some aim in your mind, you do it, and you should analyze why that contrast sensitivity is decreased in myopes.
I could find a relation, but
okay,
exactly.
No problem. Thank you.
Okay, you've done minus 6.25, you told.
Yes, sir.
And
I
you put
a
patient was wearing the glass and you checked, or without glasses?
Without glasses, I checked.
Without glasses?
Yes, sir.
Without glasses, naturally the vision will be reduced, man.
Visual acuity is reduced, but...
See, the contrast also, that fellow is going to stand at 1 meter and you are going to examine.
Yes, sir. It is 1 meter and 40 centimeters.
6 power means, you know the focal length? The focal length of the patient will be how much?
1 by... This one,
1 by? F is equal to 6. F is what? 1 by 6 meter. 1 by 6 meter means what? It should be around 15-16 centimeter only. And you are doing the test as 1 meter. Is it possible for the fellow to see? See that 6 power, he is having a power of 6, his focal length is only around 16-17 centimeters.
Yes, sir.
And you are checking the contrast sensitivity, everything at a distance of 1 meter.
Yes,
and
sir.
anything at 16 centimeter, the fellow will see better. Afterwards, naturally blurred. Then how can you see that chart at 1 meter, man?
Yes, sir. That could be my limitation. With stereopsis, I could assess it is done as 40 centimeters.
You have done now contrast.
Contrast.
Pileropsin. Understood the question?
Yes, sir. I understood the question.
Okay.